Now that you've written the answer into the journal, let's take a look at whether or not you're on the mark. What is a developmental disability? As we spoke of earlier, the outdated term for this is mental retardation. Even though it's still in the DSM-4, it's not a term you would hear used by professionals today. What you might hear instead are the terms intellectual disability, cognitive disability, or developmental disability, and they're all used interchangeably. It is not considered a mental illness. Even though it's in the DSM, it's still not considered a mental illness. We'll talk more about that in a moment. The criteria for developmental disability are very specific. An IQ assessed below 70. Normal would be about 100. The onset of symptoms must be recognized before the age of 18. And I'll tell you that most people's symptoms are recognized either at infancy or are seen to have developed before birth. The symptoms themselves must be pervasive. In other words, they have to affect all aspects of a person's development, including their emotional development, their cognition, which is a fancy way of saying their thinking, their physical development, and their socialization, their ability to interact with other people. Communication, for example, is often significantly impaired. And the symptoms are not transient, they're lifelong. They don't come and go, and they don't respond to treatment in a medical sense. So the care we provide for a person with a developmental disability is habilitative, or another way of saying supportive, long-term adaptive supports. The idea is to teach the person, provide some changes in their social environment and physical environment, and provide services to them over the long term. It's not expected that they will recover from their diagnosis. Now, you may have heard terms such as autism, fetal alcohol syndrome, and brain injury. These are similar but not the same, and we'll be looking at each of these in a little bit more detail as the presentation goes on. So let's compare mental illness and intellectual disability. Intellectual disabilities, as we've said, have a person has the IQ lower than 70, an onset before the age of 18, effects that are pervasive. The effects are both lifelong and permanent, and we would support that individual using habilitative interventions, not medical treatment. A person with mental illness may have any IQ whatsoever, including an IQ lower than 70, in which case we would say that that person has both an intellectual disability and a mental illness. But you could have an IQ that puts you at a genius level and still experience mental illness. You can have the onset at any time in your life, not just before 18, and the effects can be very selective. For example, they might affect your view of your gender or your sexuality as opposed to your entire intellect or your entire emotional spectrum. And they may be transient effects. They may be quite treatable, or they may actually come and go of their own accord. Some mental illnesses do tend to last for most of a person's life. And generally speaking, the approach we would take to a person with a mental health diagnosis or a mental illness is to try and treat them, to help them recover, and the interventions we would use are typically a medical intervention and what we call a PSR, or psychosocial rehab approach, where we look at giving the person the resources they need in their entirety of their life to help them achieve better mental health. Now, in the corner here, I've put a very small box to talk about acquired brain injury, because we get asked about that sometimes. Is an acquired brain injury the same as an intellectual or cognitive disability, or is it more like mental illness? And the answer is that it really depends on the type of brain injury that a person can have. So an acquired brain injury is an injury to the brain that can be caused by something like trauma, disease, fever, oxygen deprivation, the use of substances. Any number of things can cause it, and it can be caused at any age. The way that the person's brain is affected is quite individual, dependent on how much of the brain is affected and how impacting that injury is. So sometimes the symptoms resemble more of a mental health type of diagnosis, while other times it may be a more pervasive effect resembling an intellectual disability. Now that we've had a brief introduction into the subject of developmental disability, let's do the same thing with addiction. Let's get you to start with your journal and putting down what your current perceptions are of addiction. So using your journal again, answer, and if you have a partner, discuss your answers if possible. And if you don't have a partner, again, we'll get you to review the online comments. You should be taking approximately 5 minutes to answer the questions and another 4 or 5 minutes to talk. What is addiction in your perception, and is it an illness? How do people become addicted? Why do people use drugs if they know they might become addicted as a result? And what usually happens to addicts? Take a few moments to answer those questions, and as with developmental disability, we'll come back and reveal the answers.